I want to just introduce you to Sophia. Sophia is a 36-year-old female. She's been diagnosed with hypothalamic amenorrhea. So she hasn't actually had a menstrual period for 3 years. And I suspect that there's a significant amount of mitochondrial inefficiency and probably damage as well. I'll talk to you more about that as we progress. But for now, I just want you to have that in the back of your mind, because when I met her and I was talking with her, we sort of unpacked it all a little bit. And I was like, I think something's not quite right from a mitochondrial health perspective, and really wanted to understand what was the driver behind that. And so when we're thinking about mitochondrial inefficiency or mitochondrial damage, we're obviously looking at what has occurred in our patient's life themselves, but equally what was happening before their parents conceived them and what was happening during the pregnancy of them, because that obviously influences mitochondrial health significantly. And we all need to remember that based on current science, our understanding is that our mitochondria are passed on through our mother, through our mitochondrial RNA and mitochondrial DNA, and that passes on to our children. So a lot of the mitochondrial efficiency and mitochondrial health can actually be brought back to the maternal line. And if, let's say, something occurred during a woman's pregnancy, they had exposures to various toxins that can be passed through during the conception window and be passed through during the pregnancy, and certainly have that generational impact. So that was sort of in the back of my mind when I was meeting Sophia and trying to understand what was going on for her and what would be needed. There was also, however, a really long-term history of environmental pollutant exposure throughout her childhood, throughout her teens, and also even throughout her adult life. And so we did need to unpack that quite a bit. And I did suspect that there was going to be a lot of impact from that, but we'll talk more about that and what the findings were in a moment, but have that so that you know what's coming.